Fellow Nigerians and friends around the world, good day to you all. In some of the conversations that I've had with our leader, President Tinubu GCFR, he consistently emphasized how important it is to him that we're able to reach Nigerians who are truly among the most vulnerable and disadvantaged nationwide, so that we reach them with urgent and world-class affordable care. It is a challenge that we are privileged to meet head-on, and as the Coordinating Minister of Health and Social Welfare, to this end, one of the major areas of focus for us in the health sector is not just the rapid expansion of health insurance coverage nationally through NHIA, but dealing decisively with encumbrances to access to standard, urgent and ambulatory care in our country. Recognizing that all our collective efforts at reducing maternal and child mortality will continue to be undermined in the absence of a pervasive and efficient medical emergency response architecture, we inaugurated the National Emergency Medical Treatment Committee recently. Nigeria presently accounts for a staggering 1 in every 4 global maternal deaths, horrifying statistic which implies that a pregnant woman in Nigeria faces a 1 in 21 chance of succumbing to pregnancy and child-related complications, contrasting sharply with the global average is 1 in more than 100. Timely, appropriate and efficient emergency medical response can reduce these abysmal statistics, which is an essential element to achieving universal health coverage. But we must appreciate the fact that maternal and child mortality are just two painful outcomes of a weak health system. Lack of effective medical response to man-made emergencies, such as motor vehicle accidents, as well as sudden health events, such as heart attacks and stroke, is the present state of our emergency response system. And in many parts of our country, there is very limited emergency response system in place. The architecture is absent. Every year, we have over 7 million pregnancies, of which 9% of them may develop complications, mostly in the rural areas, some small, some large. Aside from the provision of adequate pre-hospital and in-hospital emergency care and quality antenatal care and referral systems between the basic emergency obstetric and newborn centers and the comprehensive emergency maternal obstetric and newborn center facilities, CMONC facilities, as well as ensuring there is adequate financial risk protection for pregnant women in rural areas where most of the maternal mortalities are recorded. The physical response architecture must also be built and sustained. Under this administration, guidance of the President, we have streamlined the focus of the National Emergency Medical Treatment Committee through the National Emergency Medical Services and Ambulance Scheme, NEMSAS. By prioritizing emergency services for rural dwellers, we established the Rural Emergency Service and maternal transport to serve a crucial subset in NEMSAS. We also further tasked the committee to approve a work plan for the administration of the dedicated 5% of the Basic Healthcare Provision Fund, while ensuring that quarterly audited accounts and performance reports are submitted to the Ministerial Oversight Committee that I chair, even as we prepare to make the Emergency Medical Services Committee into a full-fledged agency over time. To ensure there is accountability, I'm pleased to report that under the chairmanship of Dr. Ismail Musa Jibrin, who is the chairman of the National Emergency Medical Treatment Committee, we partnered with several states, including Rivers State Government, the Bauchi State Government, as well as Plateau State Government recently, among others, to develop and operationalize state emergency medical and ambulance services. As an example, following the launch of the Rivers State Emergency Medical Services Ambulance System, NEMSAS empaneled the State Emergency Medical Service into the Emergency Medical Treatment Gateway to align our standards across federal, states, and across states, which enables standard compliance states to receive support from the Basic Healthcare Provision Fund. These critical partnerships for development expeditiously bridge the infrastructure and manpower gaps that exist between where we are presently in emergency service provision and where we must arrive to meet the emergency care needs of Africa's fastest growing and largest vibrant population. Using tricycle ambulances, port ambulances, and traditional large ambulances, NEMSAS is evolving and implementing a new emergency notification process that proactively involves all parties to the response effort, from primary healthcare center at the ward level to the local government's general hospital using state emergency number rather than a centralized national emergency number of 112. In everything that we do, Mr. President's support for Nigerian families and his concern for the collective well-being of our people has further intensified our own focus on building an emergency response architecture that will accommodate the needs of every Nigerian irrespective of age, region, education, or social standing. This is the future of emergency care in Nigeria. The road ahead literally will not be easy, but it is one worth traveling, and every citizen in our country will be better and safer for it in the long run. Thank you and God bless.